First item is a Rule 5 variance.
Morning, everyone. Morning. My name is Adam. Sanitary and environmental health. One of the programs that I manage is body art program. There's a gentleman owns a local business here in Billings. He is moving from one location to another, and in conducting the plan review for that new establishment, we found that the distance to the hand sink is outside that limitation in our local rule number 5, that being 10 feet. So it's submitted a waiver request, or variance, I should say, from that rule. And there are conditions within the variance. 3, in fact, that will label the sink, that will keep the passageway clear of individuals, both guests and other artists. And the other is that's usual. Yeah, I can't quite recall the other. It's in your bill packet. I do not see that gentleman here to answer any questions. Is there any questions for me about that?
Questions for Adam? Recommend it be.
I recommend that it was based on history compliance with this particular artist. I'd like to say that he's been around for some time, and people that he's expanding his business. I recall the third one now that it'll be limited to 3 artists, and so he's moving locations one to the next, and this space has accommodations for those 3 artists. And again, based on history compliance, I recommend that he would the variance to the health officer.
This particular sink is not located in the bathroom, as was the last one we approved. That we the variance.
Second.
Any other questions, comments? All in favor?
Aye.
Aye. Opposed, same sign. Motion passes. Thanks, Adam. Thanks, Adam. We have any public comment to the meeting this morning? Members of the public online? Anyone here with us? Hearing none. I do want to talk about one additional variant. Okay. Oh, that's right. Yep.
You all have a letter in front of you and determination on an additional variance that I would approve under my health officer authority due to some legislative changes that were pending in Helena and some other precedent that was set by the city of Billings and their building code enforcement folks. And so we reviewed some coffee kiosks and some similar sized kiosks. This is a larger coffee kiosk that'll be opening in town. It is not a mobile kiosk for some of our code guidelines because it does not have wheels on it. However, we were looking at it as a mobile kiosk, and it should have been looked at as such by the city as well. And so due to the inconsistencies in the permitting process for the building and our environmental health review, we decided to approve a variance for this individual kiosk not to hook up to city water and sewer. With the following conditions that they need to still complete a plan review for environmental health for a retail food establishment. They also need to hook up their clean water and wastewater tanks into a fully enclosed, fully plumbed system within the building, and work with environmental health to make sure that we're fully compliant with what we've outlined in the variance. And so we've let this individual and the company know that this would be the last such variance for a like size structure and a like purpose kiosk. And that future buildings like this will not classify as mobile kiosk operations in our jurisdiction. So we've clarified the inconsistencies of the city, and we've got cooperation moving forward, so we shouldn't be put in this situation again.
Do we need a motion?
We do not. I just wanted to bring it to the board's attention.
Any questions or comments for John? To the minutes. With minutes for us from last meeting,
Move we approve them.
Second. Any changes?
I would highlight the 95% satisfaction.
Full print. Coaches, very appropriate suggestion. All in favor?
Aye.
Opposed, same sign. Yeah, on the consent agenda, that's credit card approval to staff. Right under, county takes care of the bookkeeping every month. So second,
John, if we had any issues with other use.
Not for these individuals, no.
Very well.
No, none of these individuals have ever had any issues. And we have appropriate financial controls in place with fiscal. We now have a second approval for expense reports that needs to go to the supervisor. That had not been in place in the past. None.
John, you're up.
All right. Looking at this month's April health report, we need volunteers. If there are any golfers in the room or anyone interested in helping out with this year's hospice golf tournament at Laurel Golf Club. This year's tournament's going to be split into 2 days, June 4th and June 6th. On Wednesday, the 4th, we'll have a shotgun start at 9 a.m. On Friday, June 6th, we'll have a shotgun start at 2 p.m. So if anyone wants to register a team, feel free. But if you'd like to hop on over and help at the raffle table or watch a hole, there will be a prize for hole-in-ones this year. And so if you're interested, reach out to Sarah at the volunteer office, and she will get you connected to the golf committee. We had a visit a couple weeks ago from the Bombas Giving Team. Bombas has donated about 40,000 pairs of socks to us over the year, and we had 10,000 pairs donated this year during their visit to us. And so we're able to distribute those, get a clean pair of socks out to folks who need them. And whether they present to the clinic or help care for the homeless folks or anywhere else around the community, we're able to make sure that individuals have a clean pair of socks, thanks to Bombas. We also hosted last week Senator Tim Sheehy while he was in town. Had a chance to talk to him about our services and offerings, educate him about the importance of community health centers, about how we are integral into our juniors MAHA movement and making America healthy again, so that we continue to support community health centers and public health where we're able. So we discussed some of the critical federal funding issues that we've had in the past and what we might be seeing in the future, why Medicare and Medicaid are important to us, and how we utilize those funds appropriately, focused on eliminating fraud, waste, and abuse in our own system. So we want to continue to be a good federal, state, and local partner, and that was the purpose of the visit. So good. Yeah, very receptive. I think he does have a spot in his heart for healthcare, and wants to do what he can to support us locally. He was really interested in the residency program and how we are developing our rural residency program, how many physicians that graduate from the Montana Family Medicine residency actually stay in Montana, over up to 60%, and how we can be a part of the workforce needs of the state in healthcare. He was interested in seeing our work within the Childhood Advocacy Center, and how we are providing supports and a system of justice for almost 22 counties now across East Montana. Of child trauma and abuse. And there was one more thing that he took interest. Of course, veteran issues are near and dear to his heart as a veteran. And so we talked about how we can continue to be a force multiplier for the VA as they look at ways to improve veterans care across the country.
Did you go to the Southside Complex?
We did. Yeah, we talked about the need to move a specific building and create some better real estate on the south side. Yes, we did. We also, it seems like every day now we get a new White House executive order. Last week we got one on prescription drugs. And for prescription drugs as it relates to making drugs and medications more affordable, particularly insulin and EpiPens. Wanted the board to know that we are already in full compliance with that executive. And that's the way we set up our program, and it's the right way to do business within the 340B program. So nothing to see there. If you've noticed the big hole in the ground next to the warehouse, construction began on the bus barn. And so we expect that construction to take about 90 days, and that's where our new mobile unit will be stored when it arrives. I was all set this morning to announce the groundbreaking, the ribbon cutting for the new mobile unit and the Wellness on Wheels vehicle. However, we had that scheduled for April 30th, and the vehicle is not scheduled to arrive here until the morning of April 30th. So I want to get everybody here for ribbon cutting. And the vehicle. So we will be delaying that and rescheduling, and we'll send out a reminder to folks across the community.
In kind of unit 2 exam rooms. Has anyone tested how soundproof it is between the rooms?
So they're separated by a lobby, and we have very good coverage. We've been in similar units and explored them. So you'd be surprised how much space there is in a 40-foot RV for all sorts of
groundbreaking. Will be able to go into the.
Yeah, you'll be able to tour it. We'll show it off. Yep, absolutely. Yep. Then that's why we wanted it here. Yeah, so you could do that. Continuing in leadership, we had a group of folks ride over about 70 miles on a stationary bike a couple weeks ago. We rode into 4th place, considering all the other teams around us had 8 riders. We did pretty darn well with only 4 riders. So proud of our team supporting Eagle Mount here in Billings. We are currently interviewing folks for that behavioral health systems improvement specialist role, that new coordinator that will take on the previous Substance Abuse Connect work and help rebuild that coalition across the community, provide for mobile crisis, build out some additional behavioral health infrastructure, and work on that grant and the deliverables therein. So we should have somebody in place there soon, if all goes well. And then on Monday, May 5th, Cushing Terrell will officially be announcing that we are the beneficiaries of this year's Golf Classic that they are hosting. And RiverStone Health Kid Connect Services will be the financial beneficiary there. So if you're interested in golfing with us or popping up to Briar Creek, we'll send out the information as it becomes available. But that tournament takes place on August 22nd. That's a Friday. We had the first week of April was National Public Health Week, and so we celebrated appropriately. We continue to look for your voices and the voices across the community on what folks want to see for food safety in restaurant inspections. And then we'll jump into the public health update here, where flu season is effectively over. You can see it continuing to decline rapidly. So influenza remains low at this time. However, we did see measles come to Montana. We saw our first 5 cases of measles on April 17th that were confirmed. There are now currently more than 800 cases of measles across 26 states in the country, 10 total outbreaks, and 94% of all cases are outbreak associated. For comparison, last year, there were 16 outbreaks all year, and less than 70% of cases were outbreak associated. And so we're seeing a lot more outbreak issues this year. 11% of all cases nationally are hospitalized. There have been 3 deaths, 2 confirmed, 1 suspected, and 96% of all of those infected were unvaccinated or had unknown vaccination status. Only 2% of all 800 cases received a full course of MMR vaccine. On April 17th here locally in Montana, Gallatin County again had 5 total cases across 2 families. Both families traveled to an out-of-state private event with a total of 10 individuals exposed. They were the only known travelers from Montana. And again, all were unvaccinated or had unknown vaccination status. Because of their exposures, up to 112 additional individuals at 2 locations across Bozeman and Belgrade. And we are still within the window of possible new cases. So Friday this week will be the end of the average incubation period where we would expect new cases to arise. That's within a 14-day window. And then May 5th will be the full 21 days. So on average, you see symptoms pop up between 7 and 14 days, but with a maximum window of about 21 days. And so we're not really fully in the clear in Gallatin County until about May 5th. However, we have 0 cases confirmed in Yellowstone County. We had 3 suspected individuals that reported to local emergency rooms recently, and all 3 of their test results came back negative. So we'll continue to monitor. We did stand up and activate Unified Health Command with our hospital partners and county EM. However, we have now placed Unified Health Command in a standby state until we truly receive either our first real case confirmed or active community spread. And so
Gallatin County ones are the only ones in the state.
yeah, 5 Gallatin County ones are the only ones in the state. They were immediately isolated. They complied with that isolation request. They were tested outside of healthcare facilities, and so there were no healthcare exposures. and best practices were followed. So as long as they continue to, maintain isolation until better, there shouldn't be any further community spread.
So do you know how the testing was conducted or where or how they did it?
They did some curbside swabbing with local provider, one of their family providers. And then those swabs were sent to the state lab. We did have a call yesterday with almost 225 either individuals or groups of people. So not sure how large attendance fully was, but we had over 200 folks on the call. And we gave an update and a briefing on the status of measles in Montana, what we're doing locally to prepare. And then Dr. Littlefield gave a good clinical presentation on signs, symptoms, what to expect, what we could see, how contagious is measles, the importance of the MMR vaccine. Oh, by the way, developed in 1971 by a good old boy from Miles City, Montana, and why that's all important. So we have good question and answer. Is an opportunity to speak directly to clinicians across the community. And we've posted that publicly for medical providers. If folks are interested in that, we've sent the email widely. I can send that to the board. And also it's posted up on my LinkedIn page.
Did you read Monica Trammell's article on the Miles City boy?
I have not yet.
I'll send it to you.
All right. Read a great biography. Maurice Filament. Any questions on measles before I move on? All right. And that is my public health and health report for this morning.
Thanks. We should have seen a written report from Megan. Guessing she's unavailable this morning. So let's move on to safety and quality today. Dr. Champion.
Yes, sir. This month, we discussed three main topics. The first was about our child advocacy center. That currently is in full phase. It is all of the quality improvement activities were conducted and how it's being just monitored for ongoing operation. The second had to do with risk compliance. Apparently, we had at least some issues with tuberculosis testing, and we've now changed our process by which that's done so that we don't get false positives. And then we also had the last report on hospice. It's what was her name? You can how to say her last name.
Pander Diefenderfer.
Kendra. But she reported on how they are cross-training home care and hospice staff to cover for each other. She also described in a learning story about one agency that they would never get referrals from. So they went and met with that agency and determined that there were some fixable issues, which they did, and now they are getting. So that's about it. Any questions on that?
I know, I'm always impressed at all the stuff they do and they cover. But they don't seem to report much on improvements that have been made by their work.
Mhm.
And to me, I would also want those things for our
Sure. Although they did talk about specifically what they did with the tuberculosis issue. So that was one thing that I think of, yeah, so, and I did talk to her and asked her to include more of it.
The other questions or comments for Lionel? Hearing none, can we get a motion to accept?
So moved.
Second.
All in favor?
Aye.
Opposed, same sign. They are accepted. Public health policy, Mr. Cromley.
As we usually do, we started off the discussion of legislation, primarily from the state this time. And since that changes very rapidly, I'm going to defer to John again for a better update than I can give from what 2 or 3 weeks ago.
I can't keep up at this point, Brent. It is fast and furious, and everything at this point in the legislature has to do with the budget and property tax reform. And so they are moving things as fast as they can. The goal, I think, of both houses was to end this week and call sine die. By the end of this week, who knows if that'll actually happen, but that's their plan. And so that'll save some legislative time in their calendar, should they need to be called back for any changes federally once the federal budget passes, to take any action on Medicaid or other issues that would be impacted by changes in the federal budget. So I think that's what their goal is right now, to try to save some time for those conversations. Several interesting bills that you can see that were on the list there. One I'll talk to, since it just speaks to our authorities, Board of Health. My authority as a health officer was House Bill 888, which passed both houses. Unclear and uncertain whether the governor will plan to sign, or if he has already. I haven't checked up on it. And I haven't, because it just doesn't do anything other than just directly attack public health and boards of health and undermine confidence in what it is we actually do versus what people think we do. House Bill 88 essentially said that health officers and boards of health cannot force or compel any individual to receive a vaccine, a treatment, or anything else as a condition of release from isolation or quarantine. They took the condition of isolation and quarantine out and said, well, a Board of Health and a health officer can't force anybody to do anything. Well, we never have been able to, and we never have ever forced anybody to do anything. And so it's against public health ethics. It's against our practice. But the sponsor admitted as such. However, they felt the need to get in front of, quote unquote, any potential overzealous health officials across the state. And so they've gotten in front of us, but they're not doing anything with the law. It's just putting in Title 50 under authorities of health officers and boards of health that we can't force anybody to do anything. Again, we never have, we never will. In the case of compelling treatment, it is already covered within Title 50-17 as it relates to tuberculosis. And that is the only case in which I do not, and you do not, compel an individual, but we follow the rule of law. We consult with the local governing authority. We consult with our judicial partners at the county attorney's office and a judge at the bench, and we follow due process to ensure that we do not have tuberculosis spreading like wildfire across the state. And so there's a misunderstanding of that process, and that's why House Bill 888 came to be. Other than that, we were following the CAVA kratom issues across the state legislature. And it appears that the only thing that will get through the state legislature at this point would be a study bill that would study the impacts of kava and kratom on our community. And we have plenty of data and information to tell them what a negative impact that has on our community specifically. And so our next steps as a policy committee and board for conversations in the future will be going to our local elected officials. And so we'll be looking to county commissioners and to city council to have conversations about how can we get some of this synthetic kratom off the street and away from individuals so that we're creating a safer community.
It's on that. Not the other things that the public policy committee considered for, first of all, the Class B and SASB exemption that Don poured out earlier. That's the coffee kiosk that'll be going up in Grand Avenue on 13th Street. Copies of the letters were sent out to you yesterday. We discussed the maybe cooperating with the city to have the city attorney's office involved with some enforcement of some of the codes. That's a continuing matter. And then these, it's called now Scores on Doors. That's the system for rating food establishments, and there's a survey out going out to get feedback from the various vendors to see what type of thing should be done. And that's a continuing process. We'll be getting some results probably in the next few months.
John, what's your recommendation on that? Because we've been asked to give feedback.
You're asking me? Oh, I think that the public would like to have the ability to, go to the website and see the quality of their restaurant. And I think most of the vendors would like that too. I guess if you're 1 star, we wouldn't like it as much, but so I mean, it'll
Also put it on the restaurant door.
yeah, that's very possible. Yeah. Yeah, it's all discussions.
And how are you gonna police that? When you say Derek's a 5-star this year and he falls to a 2-star next year, I mean, you're setting yourself up for, what's the enforcement mechanism?
So
Yeah, I
our,
guess based on annual inspections, because yes.
Yep. Our sanitarians, they're currently conducting the inspections now. And so there would be a criteria for, what score equals, how many demerits on that inspection. And there would be a grace period built into that too. So if our environmental health inspector came and did an annual inspection and said, oh, sorry, Derek, you're going to bump down to 3 stars this time, unless you come up to compliance. And so there would be a grace period within that to give an establishment the opportunity not to drop, but to repair their deficiencies to maintain that rating.
I think we might be surprised that it might be pretty well accepted by the vendors. I'm thinking, I think we had kind of the same experience with tattoo parlors when we went into regulation some time ago. That they really appreciated having that regulation, and therefore they could present to the public that they are safe and sound place to get a tattoo. But we'll see. There's some feedback on the continuing accreditation process. And that was sent out to you yesterday. And then we discussed the nurse family partnership survey results. That was also sent out, which seems to be very successful with regard to working with, I think, first-time mothers, but up to the children up to about the 1st grade, I think. And the results of that connection between the nurse facilities and the families has really increased the ability of the child to adapt to life and to school and everything. So that's our committee.
The reaccreditation process for public health, is that ongoing and going well?
Yeah, I guess so. Is it next year, 26?
Yes. Yeah, we're on track.
That's important.
Yes.
Thank you.
Other questions or comments? Motion to accept,
So moved.
Second.
all in favor,
Aye.
opposed, same sign. Meeting notes are accepted. Spencer, you're up.
So, Janet put together some great meeting notes from our meeting. I'll highlight a few of the points she makes there and then expand on a few too, but we'll start off with the balance sheet. So the balance, the total assets and deferred outflows for the organization was at the end of February. So we're doing February information, 32,604,000. The key thing, I mean, the thing we've been talking about or focused on over the last few meetings has been cash. And you can see our cash continues to increase. Total approximately 12 million at the end of February. That is an overall increase of 4 million this fiscal year so far. And is an increase of 5 million year over year. So we continue to make good strides in increasing that important metric we keep talking about, days cash on hand, currently at the end of, or excuse me, at the end of February, 52 days cash on hand. That's an increase from 33 days at the end of this.
Spencer, and our target is 65 days. Or was it-
So at last meeting, we did, we approved, I mean, from a budgeting standpoint, we hope to increase 20 additional days over the next 2 fiscal years from a budgeting standpoint. So we're on a great trajectory this fiscal year. So yeah, we can 20 more days is kind of where we want to be.
And Spencer, just to add to that, our, Eric had a conversation with our federal project officer earlier this week. And one of the questions that the federal staff from HRSA asked and HHS asked was, how strong are your cash reserves? And they're looking at that as a solid benchmark right now for community health centers and organizations because of the federal grant uncertainty and funding uncertainties that are coming down the pipe. And so that is why we did the work. That's why we put the money in the bank, because what comes next is anyone's best guess.
When you respond to that, is it just, today we have $100 in the bank?
It was a heads up kind of conversation and said, hey, if I were you, I would make sure you have some cash reserves because we don't know what's going to happen.
Okay. Thanks.
Flipping to the liability side, just biggest nugget there outside of the net pension liability is our unearned revenue. And that's primarily, I think, 1.7 million of that is related to COVID restricted funds. So, and which piece of good news is that the deadline to use those funds has been extended to June. A little more time to use those funds. If we flip over to the income side of the report, or the statement of revenues and expenditures, old habits. You can see for the month of February, our net revenue for the month was a loss of 108,000. That is compared to a budgeted loss of $7,281. Year to date, our overall net revenue is $2.9 million compared to a budgeted loss of $171,000, a variance of over $3 million. So overall, we've had a very good fiscal year. We are a nonprofit entity, so months like this shouldn't come as a great shock. The key component there is to just be looking at the overall year to date or overall bigger picture. We just focused on the revenues for a second. Revenues for the month of February, $4.6 million, which almost perfectly aligned with our budgeted $4.6 million. So congratulations to Shannon on nailing the budget overall. However, if you look into the underlying areas, there were some variances, especially in the areas of Medicare and Medicaid. we were able to offset those with increase in insurance and grants. So overall, year to date, revenues were $41.8 million compared to a budget of 39.9 million. So an overall variance of $2 million to the good. So it is nice to see a lot of improvement in the insurance space. That's a good area for us to grow. And I think in our conversation during our committee, some of that is reflective of a better than expected performance in our hospice area. So that's good to see, but especially based on the difficult decisions we had to make last year related to our hospice. So see we look at the expenses side, just to focus a little bit on some areas there. You'll see that we did have our wages and benefits month to date. For the month of February, we did have a negative variance of 117,000, but overall positive variance year to date of $1.4 million. So expenses continue to trend very well compared to budget. And if you combine both the operating revenue and the operating expenditure variances, for a $3 million positive variance overall. So I think generally the organization's operating very healthily, and so we're hitting on the metrics that we established at the end of last fiscal year. I think that's all I have. Any comments, questions?
Questions for Spencer or the staff committee members? Hearing none, can we get a motion to accept the committee notes?
Second.
All in favor?
Aye.
Both same sign. And a motion to accept the financial statements.
So, second.
All in favor? Opposed? They are both accepted. Oop, that governance committee. We met last month to go over several things we've been working on. Board member competencies. We are competency of the board and effectiveness of the board, obviously, is the sum of all those parts. So we've been paying a good deal of attention to this. We have surveyed all the board members multiple times about what they would like to know more about. And we are putting together a summary to bring back here hopefully next month of those findings. I think we're in pretty good shape. General. Certainly the feedback from the board members has been positive. Michael, did I say that appropriately?
Yes.
Thank you. Coach, what is one-on-one coaching and peer evaluation?
My thought was all of us benefit when we get good feedback. And I was going to suggest that we find a board member whose opinions we value and ask them for feedback on our performance. And I have done this with people in the past. And my approach is usually to start out with telling them what they do well, and then asking for areas where they can improve. I mean, that's the essence of coaching.
Yep. That would be one-on-one conversation.
Yep.
Any thoughts or comments for Coach?
And maybe just a point of clarification in your model, you're suggesting that, that we each individually can select someone on our own. So,
Yeah, because, I don't think an outside person would know who I'm most comfortable talking to.
sure.
Would it be appropriate for Spencer and I both being bean counters?
It'd probably be good.
Just wanted to make sure.
And Michael and I for being, or Brent and I for being older.
Thank you for correcting that and leaving me out.
Yeah.
John, you had some other updates we discussed.
Yeah, I will say round of applause for Jeff Hurt, as this will be his final Board of Health meeting before he retires and sails off into the sunset. So, thanks, Jeff. Appreciate you.
Thank you, guys.
Bless you.
I've been too quiet. Something different. I'm not going to comment on the House bill that makes vaccination more. Never mind. A long time ago, I forget how many years ago it was, when we were looking for a human resources person to run that operation. There were two candidates that stood out amongst those that were interviewed by John Felton. And one was a younger person with tremendous potential, but John said, we have to go with Jeff because he has the experience and is the perfect fit for the organization. And he's proven that to be true. He's been a tremendous contributor to the organization.
Thanks, Mike.
Thank you. Yes.
Thank you. Does he have a replacement?
Sitting next to him for the moment, Alexis, his understudy, will be sliding in to cover HR.
He's highly qualified. Our condolences.
Unfortunately, she was trained by me, guys. Yeah.
Hospice and home care has some turnover.
Yeah, and unfortunately, we lost for us, and kudos to her. Kendra Diefendorfer moved up the street, is taking on a role of medical practice management for Intermountain Health, and has left us as our director of home care and hospice, or home health and hospice. So Eric is currently looking at the home health and hospice leadership team and creating some connections there for folks to manage and supervise operations within home health and hospice. And so we'll be determining the future of that role shortly. But Kendra had been here for 13 years. Yep. 13 years, and she felt the need to spread her wings and go learn some new things and take on a new challenge, and we always support that. She'll be back.
You want to speak to the other 2 points?
Sure. Only other 2 things. Our overdose response workflow had been implemented and worked the way it was intended. We had an uptick recently in some overdoses. Our spikes were detected. We determined, how the drugs were moving across the state, and we were able to implement a public outreach campaign, educate folks across the community that there was an issue in supply, work effectively with law enforcement and others to get the word out and offer additional resources for harm reduction. And so that plan worked. I think we were able to save some unnecessary overdoses from occurring in the community and educate folks on why things have been happening the way they happen. And then we continue to monitor, as earlier mentioned, some of the clawbacks of funding that had occurred, funding that wasn't already within the organization. I saw about $180,000 pulled back from our Resilient Yellowstone initiative and other things. One of the things that we mentioned to Senator Sheehy when he was on site was the fact that just because it says COVID-19 funding doesn't mean that it's just sitting around or that we're needing to use it to, force vaccination and masking in this perceived world. The reality is that we've been using that resiliency funding and grant funding from the pandemic era to recover from the pandemic, to help us manage sicker patients with more comorbidities because they delayed care, to help us implement our mobile wellness on wheels program, build the bus barn, buy the van, and implement a plan for increasing access to rural healthcare, rural dentistry, rural behavioral health, because we were able to, and others like us, were able to get permission to use some of those legacy funds for innovative projects where there is no other funding. And so we were leveraging the federal funds that we received there to do some really innovative entrepreneurial stuff to help improve healthcare access in the community, not just use it for the COVID things. And so it's real easy for the new administration to come in and say, oh, that's COVID funding, pull it back. But without lifting the hood and checking under the covers to see what we're actually using that money for, you're now putting rural frontier Montanans and patients that we serve at greater risk because we now won't have the funds to do the great work that we do. That's it.
Great. Any questions for the committee, among committee members?
The foundation, do they have a new executive director?
Not yet. Not yet. We did, we went through a round of interviews and didn't get a candidate. And so we had, the position was still posted. We did a first round interview of that new candidate, and we'll be bringing them here on site next week or the week after, I believe. And so we hope to be able to lock that down and make an offer soon.
At some point, we should mention also that the recent volunteer luncheon, for those people not there, one of our group was honored as being the outstanding board member.
Who was that?
They were our new distinguished chair.
Who it was,
Our new distinguished chair of the Board of Health was our board volunteer of the year this year. So thank you, Jim.
You're welcome.
Thank you.
It's amazing how far the skill of being able to run a 10 key by touch without looking at it can take. Professional. Thank you. Thank you to the board, the organization. Can we get a motion to accept?
Moved.
All in favor? Aye. Opposed, same sign, hearing none. They are accepted. Any old business to come before the board this morning? Michael?
Towards the end of last meeting, I was rambling a little bit about how we were making avoiding vaccination. And Stuart chimed in and said that he had to disagree with me 2,000%. And I had to look it up, Wikipedia. I had to look it up, and I found out that in legal terminology, when an attorney disagrees 2,000%, it means that they disagree a whole lot. Stuart took me aside and straightened me out and explained where I was wrong, and I appreciate him keeping me on track. You're allowed to continue to, you will have to, you're allowed to keep me on track however you wish. Thank you, Stuart. Very kind.
So Stuart, put the rest of us on track.
Will do. I haven't seen a bill yet, though. That was free of charge.
Pro bono, huh, Stuart? Any other old business? Hearing none, as you saw in the governance notes, John gave us an update of some strategic planning activity that he's doing with the organization. And I asked him to bring it to this group and share it with us. Those of us who've been around since before the pandemic remember when we were engaged in this stuff. It was on John's review to either get us back engaged in that or to get the organization on that track while we get this feedback why it shouldn't be done right now. And he brought this to us and I asked him to share it with the full board.
Yeah. So one of the things that we do need action on, the full notes of our strategic planning conversation and exercise were included in the packet for your timely review. But one of the things that we will need approval on is update to our organizational vision statement. And updating to make it more aspirational and give us a charge so that everybody knows why we exist, what we do for this community and how we do it. And so our mission hasn't changed. Our mission is still to improve life, health, and safety. But our vision has become a more aspirational statement to say RiverStone Health is creating a healthier, safer community where everyone can live their best life. And give that to you first for your consideration and comment. Have a motion to approve.
We approve the new statement.
All in favor? Opposed, same sign.
Thank you. No additional changes to our health acronym or our health strategic pillars. The other items that I have included in the packet for conversation. Go ahead, Coach.
Down there under the pillar on health, it says be the provider of choice, which might be a little overly ambitious. I would think we should be one of the providers.
We're going to be overly ambitious, John.
Okay. I just wanted to be realistic.
Hey, if you selected a visionary leader a couple of years ago, so I'm going to keep being visionary. It doesn't mean we can't be collaborative, but we've got to be visionary. And, we did include the next under the education strategic pillar. We had a good conversation in governance when we talked about this. To inspire and develop healthcare and public health professionals across Montana, to make sure that we're not just focused on educating and inspiring new professionals, but as our existing professionals as well.
So the one thing that comes to my mind is we're educating professionals, but what about, we talked about educating just the population in general, or should that maybe not really be here?
I think it's something that we do within education, within leadership, within protection. I think one of the core roles of public health is to educate and inform the public about making the healthy choice the easy choice and the safest choice. So I think that's somewhere within what we do as a health department.
Maybe under the health, number one, it's been very
We could be within health. It could be within education. We could create, we have an establish a growth mindset for internal staff education and development. But we don't mention specifically educating the community. One of the ways that where we do mention that is in leadership. And our goal to integrate health in all policies and inject community health priorities into external organizations. And I think by building relationships, by educating the community on public and community health, we are and what we really do. We're nipping at that.
Because number two right now really targets healthcare professionals.
Correct.
And that's it. Yeah, it's covered in hotels, so that's fine.
But I think the team will look at that. One of the other pieces that came out and was updated was a new strategic bullet within health. Nowhere in there did we have any goals focused around AI and emerging technologies and other things. And so we did put a strategic bullet in there to look at optimizing technology to enhance patient and staff experience. Any other thoughts within our pillars or strategic goals?
Just mostly a curiosity of mine. Was it discussed through that SWOT analysis, any opportunity or perhaps even identified as a weakness, the pre-hospital lifeline, ambulatory opportunities as either a strength or a weakness or an opportunity?
Not necessarily, no. But we looked at protection from a public health perspective, but right, how do we, in what role necessarily could we or should we play right within that pre-hospital environment?
One of the things that is almost a daily concern that is beginning to keep me up at night is the loss of opportunity for rural residents outside of the city of Billings to obtain ambulatory transport, pre-hospital care. One rural ambulance service in particular suffered a 90% failure rate in the first quarter of the calendar year, meaning that 9 out of every 10 people who called for that ambulance, which we're talking several hundred, did not receive one. The opportunities to do something on a grander scale are so swing from one end of the spectrum to the other to be so insurmountable, or to the other end of the spectrum where there's simply not much to be done in the light of somebody else picking up that ball and really looking at it. I don't see that getting better. The fragility of our pre-hospital transport and care system, even in the places where it still works, it is very fragile, very fragile. And so I was just kind of curious if that ever came up in discussion. No.
I mean, we've had internal conversations about some of the challenges, but didn't really know what role we could play or how we could help with that. But I think it's something we ought to talk about. Yeah.
That's Derek, the number you mentioned, was that failure rate was in Yellowstone County or broader?
Yellowstone County.
Collections.
That's 9 out of 10 calls for ambulances. And it's generally called for an ambulance as an emergency situation, I assume, right?
You would assume so,
Maybe.
but it does vary. Some people have, having been the 911 director before this and having the opportunity for years to peer through statistics on everything from call diversion and crisis response to these scenarios. Some people call because they simply have no other resource. Yeah, most, I would suggest, humans do call because they do sincerely need one. The majority of rural response to anything from removing people from a wrecked vehicle and machinery, or having roll the four-wheeler to patients exhibiting health symptoms, stroke, heart attack, measles, whatever. Are staffed by volunteers. That model is failing probably at a rate that has yet to be publicly acknowledged.
I think there's opportunities there for us to have these conversations because there are other county health departments across the state that have emergency services wrapped within their scope and authority.
And that's kind of why I brought it up. The fragility of the entire infrastructure of pre-hospital ambulatory care and transport. Part of the fragility is its governance and framework. It lends itself to inconsistent and decision-making whims. We actually only have two publicly operated ambulances, two actual units. And they focus in certain areas, but the funding, the infrastructure, the governance, all of that is handled in voluntary term. There is no good funding infrastructure. There is no accountability. There is no primary alternate contingency plan for when those failures do occur. It's a rather concerning system that I think is experiencing failure, as I mentioned, at a rate that we have yet to publicly acknowledge.
Derek, within Billings, there are a variety of ambulance providers. How many, do you know, how many of the ambulance calls, how many are handled by those two public units versus the rest of the proprietary companies?
It's a majority. So the city of Laurel has an ambulance that is funded by the city of Laurel. 50% of their work is outside of the city of Laurel, and 0% of their funding comes from outside the city of Laurel.
Yep.
As their call volume is rising, they've passed mill levies inside to fund a city ambulance. But as their call volume outside of that city is rising, the administration, and rightfully so, has considered scaling back. So you're probably, I would have to get the exact statistics. Outside of the city of Billings, we're talking several thousands of medical calls every year. Probably a little better than a third, I think is a safe assumption, are handled by the two existing. AMR does a very, very good job for being unfunded, uncontracted, and unobligated to attend to the other, say, 2,000 calls per year in those rural areas. But as the demand inside the city grows, they simply have no funding mechanism to pace that growth. And their inability, the delays in the systematic process, sometimes it's hours before people receive an ambulance, and sometimes, as I mentioned, they simply don't. Talking with one of the ambulance providers that handles the majority of the calls from, say, Lockwood East, Borden, Huntley, Shepherd, he says within 12 months they'll be forward. And there simply is no other alternative.
Your question?
So back to my original question. I was just curious if it came up, if it had ever been discussed, explored.
Not during my tenure yet.
Or perhaps it's not something that could be. That no one had asked.
So, no, possibilities.
Yeah, I don't know much about it. I'm curious.
I could probably go on, but this probably wouldn't be.
Well, I'm tempted to ask questions too, but that'd be great.
Yeah. There's a reason I drink a cup of coffee every day. That's just one of them.
Yeah. No, thank you.
Supposed to be connected, aren't we? Connect people and resources. I don't know, this is something that we ought to perhaps put on an agenda at some point somewhere.
Or maybe have the public policy committee.
Yeah. Any other thoughts that come to mind when you look at our strategic goals and pillars? All right. Everyone, okay adopting these strategic guardrails for us?
Motion to accept.
So move.
Second. All in favor? Opposed, same sign. Thank you, John.
Thank you.
I first saw these documents that Aaron Lambert's orientation. We've talked for years, again, probably since before the pandemic. When we've talked about a lot of things about how we communicate to the public, you know, what is each of us going to say in an elevator conversation? When somebody says, you know, Jim, what are you doing these days? Yeah, I'm on the Board of Health. And do you know what the Board of Health is? Yeah, and we've talked about having a card per se, the concept of a 3x5 card. Imagine a 3x5 card in the wallet or in your pocket you pull out and say, this is the Board of Health, this is what RiverStone is, this is what we do. When I first saw those first two slides, I looked at John, I said, you know, in those first two slides, there's the source, at least one approach for that 3x5 summary of what Yellowstone is and the Board of Health.
I think that's really true within our that main operational slide that I always show when we talk about who is RiverStone Health and why do we exist. And I'm going to bring that up again for everybody to see.
You could almost have like a little business card. Well, here he is.
Yeah. Yep.
And would you want to mention the residency program up there?
Education and Training Center of Excellence.
Yeah,
We-
people
we-
don't
we
know
put,
what
well,
that
I
means.
bring that down to the actual, what do we do within the deck? When we talk about those things. I think that was the highlight slide that really got Senator Sheehy engaged too, of just seeing where our residents have been placed throughout the years, and why it makes a difference from Sydney to Polson and all points in between. So it's an opportunity for us to continue to share our story and tie it all together.
Other questions or comments? Good. Motions we need there, Carrie.
I think so.
Time for a roundtable. Anybody have comments about the meeting? Spencer, let's start your side.
No comments.
Final.
It's too bad that the people who are asking for variances from here, because, or at least to that didn't attend, because they usually have. in the
Yeah.
past.
Yep.
Maybe they thought it was just, it was a chip shot, you couldn't go in anyway. So we're here, organization.
They're mentioning things.
You can tell them that it didn't pass initially, and oh, wait a minute, it's just funny.
And well, I know that if there's any issue with the kiosk and they wish to appeal or have any further conversation, they will be here in the future. The body art one was a low risk.
Additionally, I thought the financial was clear and concise and could understand.
A little concerned about board attendance. Do we get feedback from people that can't make it? Or debate?
We've had everyone was excused this month.
Okay.
Yeah, we didn't have any unplanned.
Easy.
My question is, Jeff, how long have you been here?
I'll be 13 years on May 9th.
That's impressive.
Thank you.
And equally impressive is that Michael remembered a conversation that he had with.
It's just a memory he's got.
And I wanted to tell him I appreciate the kind comments, but the Broncos are still going to lose to the Chiefs this year.
Don't get me started.
Oh, comments from the CEO,
Nothing additional.
Derek,
Sure.
thanks for the input on the ambulances.
Yeah.
Obviously that perked up a lot of ears in the room.
Yeah, don't know if it necessarily fits here or not, but just
Yep.
conversation and
Challenge. Thinking of that, the backpedal, Senator Sheehy was here. Did you have a sense for his support of general healthcare funding or anything in particular? Any of those milieu of aspects in particular?
Gotta mull that one.
Okay, we'll come back to you, Coach.
You know, to me, super meeting, the stuff that just was discussed, I thought was super. And gee, we got at least 40 minutes, we could bring up other stuff.
Anything on your mind this morning?
No, but in the past, we used to get reports on stuff that was being developed.
Yep. Michael?
I like Lionel's comment about education of the public in general. I'm trying to go through these documents real quick. There's a lot there. And it's kind of buried in there. I hope it doesn't get lost.
Yeah.
I think that's an important part of our mission, that education. It's in there, but we can't forget that we have a responsibility to educate.
And I think that's intrinsically baked into what we do in public health work and what we do in community health. And we had a webinar for 250 folks yesterday, and we didn't have to do that, but that's our mission. That's what we do. And we felt a responsibility to take that on and do it. So, but I agree with you. We can't forget why we exist and find new ways to reach new people across the community.
So if it's central, not central, do, then should we say something?
And call it out.
In a real, call it out.
Rather than just assume.
Yeah.
So maybe it's something to think about.
No, I like it. I like it.
In the documents.
Thank you for the feedback. And I just say, from a content perspective, we missed our chief medical officer report this morning, so we had some time there. But I will honestly tell the board that I haven't pushed many folks right now because we are all tapped to the max. Between dealing with the legislative pressures and the changes that come out every single second of every single day from our federal partners, trying to maintain our act like a duck and be calm on top of the water and paddle like hell underneath. That is what every single person in this organization is doing right now because there's so much uncertainty and chaos. And add a potential measles outbreak to that. And I didn't ask anybody for anything additional this month. So that's on me, extra time.
Okay. Jim,
Yeah,
as long as we have time.
we're fishing this weekend.
Looking at not all, there isn't all that much, but all the epidemiologic data coming out of this measles outbreak, all of the numbers are consistent with measles over the decades and back when it was common in terms of the numbers of people, the percentage of individuals vaccinated that still get measles. All of the data is consistent. And one of the things about this particular virus is that it does not mutate, and that's a requirement for having an effective vaccine. This organism is stable as can be, and that's why the vaccine works so well. But it also is why its virulence is still where it always was, and why, as I've said many times, measles scares me. And virulence of this hasn't changed, and the vaccine still works. They go together.
Yeah. If there was one of us in here carrying the bug and most of the population in this room was unvaccinated, 90% of the folks in the room would walk out with it.
I just flew to Houston Airport not too long ago.
So are people who get vaccinated and get measles, do they get as sick as the unvaccinated?
No,
It's that, I don't ever see that being mentioned. It's another reason to get vaccinated.
and the likelihood, like you've seen, is about 1 to 2%. Right? So we've got a vaccine that is 98+% effective at preventing illness. And I'm happy to report that 100% of our staff are compliant with have received the MMR vaccine. So
Excellent.
we are prepared.
Other comments for the board this morning? Hearing none, we are adjourned.